Hello, my name is Brad Carlin, and this is my talk on therapeutic songwriting for persons with dementia, PWDs, and their family caregivers, FCGs. So here's an outline of my talk. I'm going to start by introducing and describing the method. I'll review some of the literature on PWDs and also older non-demented adults. There's also some literature on FCGs I'll talk about. There's clinical applications with PWDs and FCGs. Then we'll move on to strengths and limitations of songwriting with the two groups. Talk a little bit about contraindications and assessment procedures to determine the clinical appropriateness of songwriting in this group. And finally conclude with some areas for future work. So according to Professor Bruscia, compositional methods are those where the therapist helps the client write songs, lyrics, or instrumental works, resulting in a musical product of some sort. That product's often a copy of the words or a physical chart of the song, words and chord changes, or it could be an audio and video recording of the song. Music therapist often handles the more technical parts of the process and engages the client at some appropriate level, helping with the words or the music if that's a sensible thing to do. Goals of this process often include developing skills in creating a structure for expressing and organizing thoughts and feelings, developing decision-making skills, and documenting and communicating a way for others to recreate the song. Therapeutic songwriting is a compositional method variation where the client composes an original song or any part of a song, the lyrics, the melody, the rhythms, or the accompaniment, something like that, again, with some degree of assistance from the music therapist. Goals typically focus on the aforementioned creation of a vehicle for expressing thoughts and feelings, and especially the exploration of therapeutic themes through the lyrics of the song. Therapeutic songwriting is useful for a wide range of potential client groups and health and wellness concerns. For example, children and adolescents who have cancer or other life-threatening illnesses, adolescents who present with emotional difficulties, adults who are being treated for cancer, mental health issues, traumatic brain injury, substance abuse, and lots of other areas. And then finally, my group of interest, older adults with or without dementia and their family caregivers, FCGs. So this is all reviewed in the Baker and Wigram text on pages 14 and 15. Special methods of songwriting. Well, Baker in her textbook talks a lot about comprehensive review of methods for therapeutic songwriting, many of which have specific advantages for PWDs and FCGs. She organizes the methods into methods that emphasize lyric creation, which include fill in the blank, song parody, and what she calls strategic songwriting, where songwriting exercise is attempted following the lead of a pre-composed song by the therapist. The therapist in these methods can manipulate the ratio of original words to new words, which is convenient. The method can function as a primer or an icebreaker, sort of a warm-up activity to songwriting, more complete songwriting methods. These methods demystify the songwriting process, and they're suitable for brief sessions, especially if you have only one session. You don't have enough time to write an entire original song, but you might have time to do some fill in the blank, for example. And they're often preferable for persons with cognitive challenges like PWDs. Methods that emphasize lyric and music creation include singing over original music and song collage. Those are good for PWDs or others that have poor initiation or idea generation. And this can provide kind of an early success for people in that category. And then finally, Baker talks about methods that emphasize music creation, which include mashups, pastiche, and hodgepodge. These may be a little bit better for family caregivers because they allow deeper engagement. They feature structure that helps keep the songwriter focused on telling a story, removes the influence of pre-existing songs, as you would certainly have in a fill in the blank activity, tends to move people out of their comfort zones, and allows songwriters' musical identities to be explored. So in terms of the literature review for PWDs and for older adults, there's one really remarkable paper by Hong and Choi, came out about 10 years ago. These authors randomized 15 PWDs in a Korean nursing home to an hour of music therapy per week for 16 weeks, and then 15 other PWDs to a control group who received just free time instead of the music therapy. Songwriting activities included assessment of preferred music, discussion of ideas and modification of lyrics of a preferred song, and then singing or other game activities based on the song once it was ready. The remarkable thing about this research was that all 15 PWDs in the experimental group experienced greater increases in cognitive function as measured by a Korean version of the MMSE, the mini mental state exam, than any of the 15 PWDs in the control group. So this is what statisticians call stochastic ordering. The entire group, the entire treatment group did better than the entire control group. So really a slam dunk victory for fill in the blank songwriting with this group. Never seen results quite this significant before. Most of the other papers in this area are with smaller sample sizes and don't achieve statistical significance of quite this magnitude. For example, Clark et al. In a 2020 paper studied the effect of 6 weekly 1-hour therapeutic songwriting sessions on 10 dyads of persons with dementia and their family caregivers, and found some evidence of beneficial impact on depression for the PWDs and some evidence of benefit in quality of life for the family caregivers, though they didn't find statistical significance really anywhere. Similarly, Baker and Ballantyne used songwriting approaches, but this time with 8 non-demented retiree volunteers. There's not as much literature with non-demented retirees, but this was a paper analyzing 8 folks that were living independently in a single retirement village in a suburb of Brisbane, Australia. Using some thematic analysis, they found that group songwriting, as assisted by 8 very capable student volunteers — remember, there's only 8 volunteers in the non-demented retiree group, so it's a 1-to-1 student-teacher ratio, if you will. Anyway, this result was that the thematic analysis helped folks feel more pleasant, more engaged, and more meaningful. These were the 3 themes that Baker and Ballantyne grouped their findings around. On the FCG side, Baker, there's a lot more work actually in this area. Baker in 2017 developed and theoretically justified a 12-session music theory songwriting intervention where the FCGs co-created 3 songs that focused on 3 different topics. One was expressing the good and bad of the caregiver journey. Second was exploring their changed role and caregiver identity. We'll talk about that a little bit later. And the third was identifying healthy coping skills and strategies. And the experience with just 4 family caregivers experiences writing a single song. The first song in this list is reviewed. So this was really just the beginning, mostly laying out the rule book and seeing if it would work in the first example. There was a follow-up paper that Baker wrote with Yates in 2018, where they used the same 4 FCG songwriters, but this time did an interpretive phenomenological analysis to analyze interview data with these folks that just completed the pilot study. A little bit later, Baker et al. Reported the results of a more extensive evaluation of a non-randomized pilot study, 14 family caregivers this time, recruited through 2 dementia daycare centers in Melbourne, Australia. The FCGs in the songwriting group showed a net improvement of about 1 standardized mean unit in a common measure of depression. So about the mean increased by about 1 standard deviation. They also did a thematic analysis of the transcribed focus group interview data that suggested a lot of advantages to songwriting over participation in other non-musical PWD support groups. And those advantages include better clarity regarding the entire carer journey, stronger group identity, and improved fostering of inner strength, resilience, and empowerment. So some of these other non-musical support groups were good, but didn't have those advantages going for them. In terms of clinical applications, there's an older paper by Shavin in 1991. It's a little bit old really to include in this talk, but I liked it because it utilized a song parody of a very familiar song, My Favorite Things, from The Sound of Music. It went well, but some of the clients found that the lyric substitution was confusing, and they wound up reverting back to the original lyrics when singing the song. It's hard not to sing "These are a few of my favorite things" when you've heard it so many times before. So that's kind of the trade-off when you choose a very familiar song to parody. More recently, Friedman in 2011 described a songwriting works method for engaging older adults in songwriting. She included case studies in a skilled nursing context, and she suggested that it has the potential for enhancing brain health. As of the paper's publication date, she claimed that over 3,000 older adults had participated in this program, composing and performing more than 300 songs. So she certainly has a lot of experience working with this area. Young, in a paper that was in the guidelines for how to work with music therapy in mental health contexts, laid out sort of a way of doing song lyric creation with clients with mild to moderate dementia. She suggests using fairly small client groups, 4 to 6 clients at a time, relatively small sessions, 30 to 60 minutes at the most. Can be a series of sessions. She wasn't too specific about how many she wanted to use. She suggested arranging participants in a semicircle, seated and facing a flip chart or a whiteboard, and then begin by engaging the clients in an open discussion that could lead to a song theme or maybe a discussion of a pre-selected theme. She also recommended asking the clients for ideas on the music. Again, the clients are often not musicians by training, but they may have feelings about fast, slow, happy, sad, and other broad characteristics of the music. So that was her kind of algorithm for getting this going with this group of individuals. Songwriting has a lot of strengths for working with PWDs and FCGs. Songwriting offers an alternative to talk therapy that stimulates thoughts and feelings in these clients, maybe even better than singing familiar songs, which is another very common technique used with this group. Songwriting can also help persons with dementia improve their memory and mitigate language loss. That goes all the way back to a paper by Silber and Hess back in '95. And of course, they feel a sense of pride in what they create as well. Turning to family carers, they report role engulfment, being overwhelmed with the new roles that they have, and in fact, losing their sense of self, and especially struggling with dramatic role changes within the relationship. For example, if you're a former wife or lover and you've now turned into a mother or a constant provider for your spouse because your spouse has now struggled with dementia. And so these are all significant concerns for family caregivers. Songwriting can help these folks explore and express emotions, experience emotional release and catharsis, engage in processing and reprocessing of complex and painful issues, express ambivalence and ambiguity, which is often how people feel in these situations, address issues of identity. We talked about the loss of the sense of self, and provide structure to tell a complex story. A song has a beginning, a middle, and an end. It usually has verses and a chorus and a bridge. And so having the structure available to tell your story is particularly convenient. Working in the context of a group provides opportunities for teamwork, for shared experiences, and also fosters trust, respect, and the ability to let others into your shared journey. What about limitations of songwriting? Well, songwriting can be somewhat narcissistic, and that may turn off some older adults, especially up here in Minnesota, where talking about yourself is not something that's generally considered socially acceptable. But it's not always the case. When you write songs about your own history or about your life journey, that actually can be very enjoyable for older adults. So this is maybe just a sort of a minor criticism. Songwriting can be intimidating. This is a more serious criticism, I think, especially if you're not a musician, have never attempted this before, regardless of whether you have dementia or not. This could be very intimidating to get started, and that's why fill in the blank ideas are often suggested as initial places to start. For PWDs, singing and creating lines may be difficult cognitively, especially on the verbal expression side. For FCGs, they may not have cognitive issues to deal with, but they may worry about revealing more information than they really feel comfortable doing. Unlike improvisation, ambiguity is harder to maintain when you're writing actual words down. So that's a possible limitation. Songwriting demands time and energy. Fill in the blank and parody, as we said before, can be done quickly and offer a quicker ramp up, but it may lead to a more kind of superficial product that doesn't really have maybe the same clinical impact. Artifacts created are sources of pride and accomplishment for the client, but their distribution can present risks, certainly risks of disclosure and possibly re-traumatization, though in this group, I'm not sure that re-singing your same songs would lead to re-traumatization in the way that, say, songwriting with traumatized adolescents would certainly have that risk. So maybe this is a smaller risk with PWDs and FCGs. Finally, a criticism that I have is that most of the research in this area is done with very small pilot studies, small sample sizes, And so, to my way of thinking, the scientific evidence base for this method variation is still sort of weak, and we'll revisit that idea a little bit later. Contraindications and assessment procedures to determine the appropriateness of songwriting. Again, going back to the Young paper, Young notes that songwriting is contraindicated for persons who have expressive and/or receptive language difficulties, also for persons who have difficulties with focus, concentration, or just orientation to their surroundings. If after you assess cognitive status, maybe versus the MMSE exam, you realize that a client emerges as more seriously impaired, then as we said before, fill in the blank or song parody may be a more accessible alternative for persons like that. Young also suggests continue to assess during the session while you're doing the songwriting, making sure that you notice which clients in your group are not participating in the discussion, maybe having more trouble focusing on the topic at hand. And for these clients, she recommends providing verbal cues or questions or choices, other ways to try to keep clients that are having trouble focusing, stay focused and contribute to the effort. For family caregivers, songwriting may be contraindicated based on individual factors such as perfectionistic tendencies. Some FCGs also have the tendency to over-intellectualize and use other defense mechanisms to keep them from really getting going on the project. Group factors can also come into play. Obviously, the composition of the group can be a factor. The size of the group, large groups are difficult to manage sometimes. Conflict within the group is an obvious problem, or lack of cohesion within the group can be a problem. So conclusions and areas for future work. Well, therapeutic songwriting can be very effective for achieving clinical goals related to self-expression, creativity, structuring experiences, thoughts and emotions, and providing opportunities for social interaction and mutual support in PWDs. Certainly PWDs often struggle to maintain social contact, and songwriting may be a big help in that regard. For FCGs, the benefits can include all these things, I think, that we just mentioned, plus emotional release and catharsis, the ability to see and share the entire care journey with other people who are on it with you, build closer bonds with other FCGs, and foster inner strength, resilience, personal growth, and empowerment. So there's a lot of upsides for FCGs working together on songs. Future work, I think, involves dramatically augmenting the research base supporting therapeutic songwriting by doing more quantitative studies with larger sample sizes, at least larger than we've seen typically in the literature to date, as well as continued discovery through qualitative research as well. We can explore the use and potential benefits of Mad Libs fill in the blank with PWDs. This is an idea I got from Lauren Book this year, and actually used it with a client, not an older client, a younger client, but it was a big hit with that client, and I think it could potentially be great with persons with dementia as well. It certainly was enjoyable when I tried it the first time. And finally, I think we should explore the use of telehealth and remote asynchronous songwriting among FCGs, perhaps using GarageBand or other easy-to-use music recording packages. The last year has certainly taught us that telehealth has a much greater potential for benefit than we previously thought. With persons with dementia, it probably would not be so handy, but with FCGs, I think working collaboratively but sequentially on a song could potentially be a very good thing. So something to look at in the future. So that's the end of my talk. Hope you enjoyed it. I have a list of references here that I'll put up just briefly. Ironically, this is the first page of the reference list, and you can see it's the Baker page of the reference list. Every single one of these papers is first authored by Felicity Baker, who's one of the big stars in this area, very active researcher. Here's the second page of references, and they are actually still including a paper by Baker. The Clark paper includes Baker as a co-author. Here's the Hong and Choi paper, the one that really talks about a careful clinical study, randomized clinical study of songwriting with persons with dementia, and then the other references we talked about. So thank you very much for your attention, and that's the end of my talk.